So welcome everyone to another one of the presentations on females' health complaints. And today we're going to be talking about understanding amenorrhea and oligomenorrhea. I'm Garreth Falls. I'm a consultant medical herbalist. Now, in relation to defining amenorrhea and oligomenorrhea, let's start by making sense of the terms. So primary amenorrhea refers to the absence of menstruation by age 15 in girls with normal growth and secondary sexual characteristics. So they have all of the bits, they've grown in all the right places, but there's still no bleeding. Or it can be if you're age 13, but there's no development of secondary sexual characteristics. And that's the primary amenorrhea. Secondary amenorrhea is the absence of menstruation for 6 months or more after previously having regular periods. You have had a regular period and then all of a sudden there has been an absence of a bleed for over 6 months. Oligomenorrhea then refers to infrequent menstrual periods and typically occurs at intervals more than 35 days to get that as a diagnosis. Now, whenever you're getting a diagnosis for either amenorrhea or oligomenorrhea, several tests are commonly going to be used, and they're going to include the blood tests that typically measure levels of FSH, LH, prolactin, and some other hormones. You're also possibly going to undergo a pelvic ultrasound to make sure that there's no structural abnormalities in place. Now, these tests help to determine whether or not it's hormonal imbalances, ovarian function, or some other underlying cause that may be one of the main primary factors as to why you're not having a bleed. So the causes and the risk factors. Secondary amenorrhea and oligomenorrhea are often linked to low estrogen levels, which can increase the risk of bone demineralization and osteopenia. Now, if estrogen levels are normal, conditions like PCOS might be the cause of infrequent bleeds, leading to an increased risk of endometrial hyperplasia and uterine cancer. Common causes for amenorrhea include stress, significant weight changes, excessive exercise, and medical conditions such as hypo or hyperthyroid or pituitary dysfunction. Now, in some cases, medicines can also cause amenorrhea. Asherman syndrome is sometimes associated with intrauterine adhesions or cervical stenosis, which can obstruct menstruation. So understanding the hormonal patterns is really what's critical if we're going to treat these conditions successfully. Quite often there's going to be low gonadotropins and low estrogen, and that may indicate functional hypothalamic, anovulation, or perimenopause. You may have a high FSH on your hormones, and that would suggest ovarian dysfunction, such as premature ovarian failure. You may have high LH, and that would point to PCOS, polycystic ovarian syndrome. You may have high prolactin, which can indicate a pituitary tumor, or your testosterone and DHEA levels may be out of whack. And if they're mildly elevated, it can be to do with PCOS, or it can also be to do with hypothalamic pituitary dysfunction. Now, it's important to note that hormone levels can fluctuate throughout the menstrual cycle. So knowing exactly when in your cycle you are getting your tests done is pretty important. Now, that's difficult to do if you don't know when your next bleed is going to be, or indeed when you last had one. So you may have to find that repeating the blood tests fairly frequently is important to try and get accurate readings. Now, conventional treatment for amenorrhea typically involves addressing the underlying cause, and that can include hormone therapy such as progesterone supplements to try and help restore the menstrual cycle. Now, in some cases, managing stress and ensuring proper nutrition or lifestyle adjustments are put in place are the essential first steps. So rather than going on to a hormone balancer first, if you start to alleviate some of the other triggers, you might find that your hormones will come back into balance. Now, in relation to a herbal management strategy, let's discuss the ways forward. The goals here are to reduce stress, to support healthy body weight, to modulate the hormones, and to improve pelvic circulation. So here are some of the key approaches. To reduce stress and to support sleep, herbs such as motherwort, this is Leonoris cardiaca, Sisyphus, and adaptogens such as rhodiola rosea, Schizandra sinensis can be really beneficial here. For the sleep support, I might be using things such as lemon balm or valerian or passion flower that are slightly more sedative. Hormone modulation is next, and we want to use herbs such as Angelica sinensis. It's known as Dong Quai. Licorice and peony, both of those have to be together. Licorice works on the adrenal glands, peony works hormonally, but they work synergistically, and the scientific literature now supports both of those herbs being used together. And chasteberry or Vitex agnus castus, which is also traditionally used very successfully to balance hormones. One of the other things that we might consider is pelvic circulation. So there's a number of uterine tonics where they stimulate blood circulation in the pelvis area. So herbs such as black cohosh or Actaea racemosea or Artemisia species can be really helpful at supporting blood flow to the pelvic area. And my favorite here is yarrow. We want to support the HPO axis. This is the hypothalamus pituitary ovary axis. And this plays a crucial role in regulating your menstrual cycle. So we can support that axis by a number of different pathways. We can do it by reducing the prolactin levels. And to do so, we use herbs that are called dopaminergic. They're ones that will work on the dopamine pathways. Herbs like black cohosh, peony and licorice, which you mentioned earlier, and chasteberry. We want to use steroidal saponin-rich herbs such as Dioscorea villosa. This is wild yam. Asparagus racemosus is shatavari, and Tribulus terrestrius. This is useful for the pre-ovulation phase of the menstrual cycle. You also can look at improving the estrogen levels within your body, incorporating phytoestrogens such as soy, flax, red clover can really be beneficial at modulating estrogen levels. Now, next up, we want to look at the diet and lifestyle and ways of managing amenorrhea and oligomenorrhea. So a balanced diet is absolutely fundamental, ensuring that you get an adequate intake of fats, carbohydrates, and proteins distributed throughout the day to encourage a normal hormone pulsation. So the reason for that is because during the day and night, your cortisol levels fluctuate quite wildly. And if you have small meals throughout the day, you're much less likely to get spikes in your blood sugars or in the cortisol readings, and that will involve less stress on the hormones and the adrenal glands. We want to encourage that you avoid intermittent fasting. Now, I'm generally a fan of intermittent fasting, but this can cause significant drops in blood glucose, which can disrupt hormone imbalance. So if your hormones are already imbalanced, it just does not make sense to exacerbate that any further. We want to look at nutrient-rich foods. That includes things like nuts, seeds, dark leafy greens, legumes, fruits, fish, and whole grains. Foods rich in anthocyanins like elderberries, blackberries are really useful. And we want to look at nutrient support. So this is making sure that you have an adequate intake of magnesium, of zinc, which is important for your dopamine pathway, for iron, particularly for those who exercise, and then vitamins A, B, C, D, E, and K. So I want to give a short example of a herbal formulation that I might use for somebody who needs encouragement to get their cycles becoming more regular. I might use something like black cohosh, Angelica sinensis, Leonoris cardiaca, Peony lactiflora, and Zingiber officinalis. So it's black cohosh, dong quai, motherwort, peony, and ginger, each at 20 mils. And you would take that at about 5 mils 3 times a day. Now, if your menstruation or your lack of menstruation is due to stress, I might consider an infusion. This could be a tea with Siberian ginseng, licorice, motherwort, mugwort, peppermint, and skullcap. You can also look at something that is familiar to many herbalists, but not done just as much today through modern medicine, and that's topical applications. Topical treatments like ginger compress or a ginger fomentation can be applied several times a week to support pelvic circulation and to relieve discomfort. Now that's really worth trying and can be really quite significantly successful at both bringing on menses and reducing any cramping for whenever it does come. And finally, it's important that you maintain a healthy body weight, that you manage stress through a balanced diet and lifestyle. Now, that is so important because quite often you will find people who are really keen on exercise, keen on losing weight, or very, very thin, anorexia, bulimia. And that is the primary reason for amenorrhea. So those are things that we want to definitely look at and ensure that the weight is stable and you're not doing too much exercise. You can also do quite a lot by avoiding beer, which can stimulate prolactin secretion. And that's also something worth trying to stay away from. So in conclusion, amenorrhea and oligomenorrhea are complex conditions that are often managed with a combination of herbal therapies, diet, and lifestyle changes. It is really key that you understand what the root cause is, though. Thank you for attending today's webinar. What I have done after the webinar is I've put a handout there that kind of goes into a little bit more detail as to what the fundamental causes are, the risk factors, and also what you can do to alleviate some of your symptoms. Hopefully you find that helpful and you can join me on some of the other presentations on women's complaints.